This is the video presentation for our novel surgical technique, advancement of rotator cuff with trapezius reinforcement. Preoperative images of a 65 years old male patient showing posterior superior massive rotator cuff tear. The procedure starts with diagnostic arthroscopy. In this patient, biceps tendon was tenotomized due to severe tendonitis. Then the subscapularis tendon is assessed. This patient had a Lafosse type 2 tear which was repaired with one knotless anchor. Then the scope view is shifted to posterolateral portal and rotator cuff tear is assessed following a thorough subacromial decompression. Rotator cuff must be comprehensively released both from subacromial and articular sides in order to maximize tendon mobility. During intra-articular release, care must be taken not to damage the suprascapular nerve, and the rasp should not be inserted deeper than 2 cm. After releasing the rotator cuff, tendon mobility is assessed. This patient did not have enough cuff excursion to cover the footprint, so a decision for muscle advancement was given. Then traction sutures through the torn supraspinatus and infraspinatus are passed. The next step of the procedure is lower trapezius harvest. A horizontal 5 cm long skin incision just below the scapular spine is performed. Lower trapezius tendon is detached from its insertion to medial scapular spine and secured with Krakow sutures. Then supraspinatus and infraspinatus muscles are advanced using a blunt periosteal elevator from the ear fossa. The key point of this step is to elevate the muscles subperiosteally and to prevent intramuscular penetration of the elevator. Superficial attachment between rhomboids and rotator cuff muscles should be maintained. Advancement of the muscles and their increased mobility can be seen by pulling the traction sutures. The arthroscopic view shows sufficient mobility and full coverage of footprint to perform a tension-free repair after muscle advancement. Then the rotator cuff is repaired using knotless suture bridge technique. 2 anchors for medial row and 2 anchors for lateral row were used for this patient. The view after the repair can be seen. The footprint was fully covered without excessive tension. The following step of the procedure is lower trapezius reinforcement to infraspinatus. This is the cadaveric demonstration of this step. The harvested lower trapezius tendon is sutured to the upper part of infraspinatus muscle. Infraspinatus has a thick superficial fascia in this part which allows for a strong suture fixation. The arm is externally rotated and slightly elevated in this step in order to have adequate tension on infraspinatus. Cadaveric and intraoperative demonstrations of the final construct shows the integrity and simultaneous movement of lower trapezius tendon and infraspinatus muscle.